Morning.
Good morning, Miss
Good morning.
Sanada.
Good
How are
morning.
you
I'm
doing?
fine. How are you?
Good to see you
Alright.
again.
Good to see you.
Okay.
Alright.
All right. My name is Wendy. I'm a nurse practitioner student, and I will be doing your assessment today.
Okay.
Thank you for letting me be part of your care.
Okay.
And today I will be doing your musculoskeletal assessment.
Okay.
Okay.
Alright.
And I'm going to begin with by assessing. I'm going to do your musculoskeletal assessment today, and I'm going to do each joint, but I'm going to start with your hands. Okay, can you show me both of your hands? Okay, so I'm going to first observe the color of your skin on your hands. And observe for symmetry, it's symmetrical, and I'm going to palpate for any mass or nodal. Okay. And while I'm palpating, I don't feel any mass, I don't feel any nodal, any tenderness.
No.
Okay, no tenderness. All right, so what I'm going to do, I'm going to assess your I'm going to palpate the interphalanges joints. Okay, and to do that, I'm going to so palpate the interphalanges joint to the interphalanges joint. Okay, I'm palpating the interphalanges joint to see any mass, any nodal, any tenderness, and I'm palpating the metacarpal phalanges joint also. Okay, to see if there is any mass, any nodal. Okay, and I'm palpating. I'm going to palpate the radiocarpal groove. Okay, this is the radiocarpal groove. For any tenderness, any pain?
No.
Do you feel any pain? Okay, all right. So, and I'm doing the same thing with the other hand also. Any pain?
No.
Okay, all right. So, and now what I'm going to do, I'm going to do the range of motion. Okay, I'm going to do so we haven't found any nodal, any swelling, no bugginess, no tenderness, or no ganglion. So now I'm going to do the range of motion of your hands. Okay, all right. So to do the range of motion, and I'm gonna ask you. It's just few things we're gonna do. You just follow. I'm gonna guide you. Okay. So for the range of motion of the hand and the wrist, metacarpal phalanges, flexion and hyperextension. So what I'm flexion, metacarpal phalanges, flexion and extension. Any pain? No. Can you do both hands? We're supposed to do both hands. Flexion, extension. Okay, and we are going to do the finger flexion. Just bring your thumb across, yeah, all the way. Okay, all right. And then also, can you do a fist formation? That's the finger flexion. That's called the finger flexion. And we're going to do the fingers abduction, ab with the B, away from the body, and adduction, you bring them together. Okay, and we are going to do the wrist radial and ulnar hyperextension, just like that. Wrist radial ulnar movement hyperextension. Very good. Very good. So by doing it, we saw that the metacarpal phalanges flexion is 90 degrees. Okay, and and as much as 30 degree for expert extension. Okay, and the thumb opposition, you were able to do that. Okay, the finger abduction and adduction, both both were we were able to do both of them. Both were, and the wrist extension and hyperextension was 90 degrees, 90 degrees flexion and 70 degrees hyperextension. That's what we found with all those movement. Okay, and the radio ulnar motion was 20 degrees motion and 50 degree ulnar motion. Okay, so now we are going to do a test your muscle strength. Okay, can you push my hands? Okay, so it's bilateral symmetric with full resistance. Okay, and it's can you pull my hand? Okay, hand strength, it's firm and sustained grip. Okay, now we are going to do the elbow. I'm going to do expect the elbow. Okay, so we did the hand. We compare all the muscles of the hand and wrist, and now we're going to do the elbow. So we are going to, I'm going to inspect your elbow. Can I see your elbow? Okay, so I'm going to inspect the elbow. Okay, there is no nodal. Okay, at the ulnar area there is no nodal. Okay, and the carrying angle is like carrying angle. Can you do this? Is like 5 to 50 degrees. Okay, the carrying angle is 5 to 15 degrees, and I'm going to palpate with patient elbow flex at 70 degrees. Can you flex your elbow for me, like this way, both of them? Okay, and I'm going to palpate. Okay, there is no bugginess, no tenderness. Okay, no bugginess, no tenderness at the epicondyle or olecranial process. Okay, and I'm going to ask the patient. We're going to do the pronation and the supination test. All right, give me 1 minute. I'm sorry. So I'm going to ask the patient, just put your hand like, just like that. Yeah, just like that. Yeah, no, this way. Yeah, this way. So this is the this is called the pronation and the supination. And pronation and supination flexion, it's 90 degrees. Both are 90 degrees. Okay, all right. And can you do the flexion of the and extension of your elbow? Flexion, both of them. Flexion, extension. Okay, and I'm going to test the muscle strength. Okay, and maintain flexion and go against resist. Try to push me. Okay, so it's bilaterally symmetric with full resistance to opposition. Okay, so I'm testing the muscle strength here. So now I'm going to do the shoulder. We did the elbow. Now I'm going to do the shoulder. So I'm going to inspect the patient's shoulder. No, you can sit. You don't have to stand. I'm going to inspect the patient's shoulder. Okay, for size, for contour. Okay, it's symmetric. Okay, there is no winged scapula. Okay, and no tenderness, no mass, no any mass, any tenderness, no, and it's symmetric. No pain. Is there any pain?
No.
Okay. And I'm going to test the patient range of motion of the shoulder. So first we are going to do the, can you stand up for me? The forward flexion and hyperextension. Can you bring your arm behind? Okay. Forward flexion and, okay. And then also we are going to do the abduction. Abduction will be, oh yeah, we can do it this way, away from the body, and you can do adduction. You can bring it across. Okay, yes, you can do the other arm too. Bring, okay, and then the internal rotation. Just bring it to your back like that, and external rotation, just like that. Just touch the back. Okay, you can sit, and you are going to yeah, you can sit, and we are going to do go against a shrugged or shoulder. Okay, right. So with the shrugged shoulder, you can see it's symmetric. Okay, and the forward flexion, you have seen it was 180-degree flexion, forward flexion, and the hyperextension that we did, it was 50-degree hyperextension. The ab away from the body. Can you do it again? It's 180 degrees, and the adduction, bring it across your body. You already done that. It's 50 degrees. Okay, that's 50 degrees. And the internal rotation that we did was 90 degree when the patient brought her hand here. That was 90 degree, as well as the external rotation. That's when you did this touch here. That was 90 degrees. And the shrugged shoulder that I asked the patient to do, you see, it was symmetric with full resistance. Okay, and forward flexion was bilateral, symmetric, and full resistance. And we did also the abduction and adduction. So now moving along, we are going to do the temporal, palpate the temporal mandibular joints. And really the rotated cuff. The temporal mandibular joint. Okay, so I'm gonna ask the patient to can you clench your teeth? And I'm going to palpate the masseter muscles. And there's no snapping noises, there is no clicking, okay? There is no crepitus. Any pain, my dear?
No.
Okay, no pain, no popping, okay? And can you open your mouth? Okay, all right. Okay, all right. So, very good. And what I'm gonna ask the patient to do, I'm gonna do a range of motion. I'm gonna ask the patient to open and close her mouth. Open her mouth, open again. See, when she opens, it's 3 to 6 centimeters between lower and upper teeth. Okay, that's expected. And can you move your jaw laterally, side to side, and her mandible move 1 to 2 centimeters. Can you move it for me? That's expected. Move 1 to 2 centimeters in each direction. Okay, and I'm going to test the strength of her temporalis and masseter muscles. Okay, so I'm gonna ask the patient to clench her teeth. Clench your teeth. I think I already did that. While I'm palpating, it's bilateral, symmetric, with full resistance to opposition. Okay, all right. And I'm going to ask the patient, can you go this side? Okay, against resistance, very good. Against resistance, very good. And I'm going to inspect, so now I'm moving to the cervical spine. okay? I'm going to inspect the cervical spine for cervical spine for I'm going to inspect the alignment, okay? I'm inspecting the alignment, okay? With head erected. Can you bring your head this way? Okay. So, okay, and the other way too. Okay. And I'm expecting for skin fold. So you can see her cervical spine is straight, okay, and symmetric with full resistance when she goes side to side, okay? And then her skin fold, there's no like asymmetric skin fold or no weather, okay? And I'm going to palpate her spine and paravertebral, the trapezium and sternocleidomastoid, okay? Good muscle tone symmetry in size, okay? And forward flexion 45 degrees. Can you like bend forward and then side to side, this way, side to side, okay? So forward flexion 45 degrees, okay? She can bend your head forward, tuck your chin, yep. And then the lateral bending, bend your head to each side, and you can see 70 degrees rotation, okay? All right. I'm gonna ask the patient to maintain each of her previous position, and I'm going to assess for, okay, go ahead, against, to assess for symmetric strength, full resistance. Okay, go ahead, while I'm trying to oppose to you. Very good. And now I'm going to assess the patient thoracic and lumbar spine. So I'm gonna ask the patient to stand up. So we're gonna do this. I'm gonna look at the patient back, okay, from C1 to C7, okay. I'm going to observe to see if it's straight, the scapula, okay, the iliac crest to see the curves, the lumbar spine is concave, the curve of thoracic spine is convex, and her knees and feet are aligned with the trunk and pointing directly forward, okay? All right, so this is it, okay. All right, and I'm going to palpate the spine and paravertebrae, okay? I'm gonna ask the patient stand straight. I'm going to palpate, okay? There's no popping, no muscle spasms, no tenderness, no pain, okay? All right, and I'm going to test the range of motion. Now we are going to test the range of motion of the spine. All right, so the first thing we're gonna do, we're gonna do the flexion. Can you, like the flexion, can you act like you're gonna touch your toes, bend over? So I'm looking to see, okay? I'm looking to see forward flexion. It's 75 to 90 degrees flexion, okay? The patient back remains symmetrically flat as concave curve of lumbar spine, okay? Of lumbar spine becomes convex with forward flexion, all right? So that was the forward flexion. That's very good. Try to do the hyper extension. That's when like you lean on the back like this. Yes. And It's about 30 degrees hyperextension with reversal lumbar curve, okay? That's good. It's okay. It's good. And then now we are going to do the side to side, okay? The lateral bending, side to side, okay? Can you do that? Good. Very good. And we are going to do the rotation of the upper trunk. It should be like 30 degrees. Okay, good. Very good. All right. Rotation is like 30 degrees. Very good. You can have a seat now. Take a little break. And okay, now we are going to test the lumbar nerve rotation. This, I don't think we're supposed to do that. I'm gonna skip and do the hip inspection. Okay. I'm gonna inspect her hips for symmetry and level of gluteal fold. Can you stand up for me? So I'm going to inspect your hips, okay? So it's symmetric, okay? Symmetric iliac crest, size of buttocks. Can you turn around? Size of buttocks and level of gluteal. There is no gluteal fall, okay? All right. You can sit. All right, so we are going to do the range of motion of the hip. So the first thing we're gonna do, I'm gonna ask the patient to lay this side. And I'm gonna ask you to lift your leg like that. Okay. This is called hip flexion. Okay, flexion, knee extended. This is like 90 degrees, straight up. This is 90 degrees, okay? And the hyper extension, I'm gonna ask you to lay on your abdomen, on your stomach. All right, and this is the hip extension, okay? The hip the hip extension, knee extended. So this is like 30 degrees. Can you lift this one a little bit? Yeah, like 30 degrees, okay? And you can come back to and now I'm gonna ask you to flex your knee like 120. This is like 120 degree flexion, okay? All right, and we are going to do the abduction and the abduction. Like I said, ab with B, away from your body. This is the abduction, and the adduction you can do like this, okay? And we are going to do we are going to do the internal rotation. You can just do like that, okay? The internal rotation, 40 degrees. Your knee should be flexed and rotated leg inward toward the other leg. And the external, the aspect of the foot or knee of the other. The external, let me guide you. It would be easier. Let me guide you. Yeah, the external rotation. Okay. All right, so we are done with this. Now we're moving along to test the muscle strength, okay? maintain a flexion position of your hip. Okay, and while I'm pushing, you push against me. Okay, now lift this one. Okay, push against me. So see, bilateral. I should do this one too. It's bilateral, both bilateral. Good, good. So it's bilateral symmetric with full resistance. All right. So we were testing the strength, the muscle strength. Now I'm gonna ask the patient. You can come back and sit normal. Now we are going to. I'm going to inspect your legs and knees. Okay. So I'm going to palpate the patient knees. Okay. I'm inspecting now. I'm inspecting natural concavity on anterior aspect of each side above the patella. Okay, and I'm going to palpate. Okay, for any effusion, any masses, any mass. Okay, no mass. Femoral joints. It's smooth and firm, no tenderness. Okay. Bend your knee, straighten your knee for me. Bend it and straighten. Same as here, no tenderness, no effusion, no signs of effusion. And I'm also going to palpate the popliteal space back here. No tenderness, no effusion. Okay. All right. All right. No swelling. It's smooth, firm. Okay. All right. And now we are going to do the range of motion. Okay. I'm gonna ask the patient to stand up. So full flexion is okay. Do like this, 130. I'm sorry, extension. This is extension, 15 degree. Full extension up to 15 degrees, and full flexion. Okay, very good. Can you do the other one too? Very good. So full flexion is 130 degrees. Okay. All right. You can sit. You can sit. Oh, you know what? I want you to walk forward. I want to watch your legs. All right. All right. Come back. Okay. And then you can sit. And I'm going to test the patient muscle strength. Okay. All right. So I'm sorry, I made you sit down. Stand up. Okay. So while you have a flexion, put a flexion. Okay. Go against my arm. Oh, good. Very good. Do the other one too. Okay. Go against my. Okay. Very good. So I was testing. Oh, you can have a seat. I was testing the strength of the muscles on that area. You can see it's bilateral and symmetric, full resistance to opposition. Okay. Okay. All right. There's other techniques where you can test like this, but we're not going to go into detail for this time. So now we're moving along. I'm going to perform the test for the feet and the ankle. All right. I'm going to note the major landmark, like the archer back here, the archer muscle back here, and I'm going to palpate. It's smooth, okay? No tenderness, no popping, no clicking. All right, and I'm counting the digits 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Normal digits, okay? And I'm inspecting the heels, okay? And I'm inspecting the metatarsomphalangeal joints. The metatarsomphalangeal joints, okay? All right. Okay. And All right. And the toe on each foot is straight forward and flat and aligned. Okay. And no tenderness, no masses. It's bilateral symmetric. Okay. And now what we're gonna do, can you stand up for me? We're gonna do the dorsiflexion. You just follow me. The dorsiflexion, 20 degrees, like the top of your foot. I want you to bring that up. Yes, 20 degrees. The dorsiflexion, and the plantar flexion is 45 degrees. Very good. And then we are going to do the inversion and eversion. Okay, so the inversion and eversion. Inversion is this way, you bring it inside, and then eversion you bring it away. Okay, inversion is 30 degrees, eversion is 20 degrees. Okay, and then we did the flexion extension. All right, you can see, you can do the flexion extension of your toes. And I think we are done. I think we are at the end. Thank you so much for letting me be part of your care.
Okay.
Okay.
All right. Thank you.
I didn't assess the actual muscle is right here. I think I assessed all of this. All right. Thank you for letting me be part of your care.
Okay.